It's going live.
All right.
All right, we're on here.
All right.
This is
Hello, Rajiv community. And yeah, welcome to our first ever live stream and first kind of live AMA and AMA specifically with our newly or one of our newly onboarded medical advisors. And if you're kind of new to Rejuve or just to like what we're doing, I know a lot of you may be following several other projects and things of that nature. The reason, well, obvious reasons why we have medical advisors, but the key initiative that we're focusing on here is part of a branch of our community ambassador program, which we announced a couple of months ago, and it has several prongs. And one of those is we want to empower the physicians, clinicians, pretty much anybody that's working in direct patient care to be able to connect with us directly and also be able to see the message of longevity within the actual medical space. So that's kind of the what we're really getting at here is, you know, the education, the activism, and the actual transformation of the way that medicine is practiced and the way that health and wellness is kind of rolled out in society. And it starts, you know, with your primary care doctors, with your specialist. And I know that there is several of you in the community because we had some early surveys in the beginning in our beta testing period where a lot of you indicated that you were actual clinical professionals, which is super great to hear, you know, that you guys are also knowledgeable about Web3, AI, actually doctors and nurses and et cetera. And yeah, so if you are interested in getting more involved, ambassador interest form here. It's open constantly, so you can choose which groups of that and which initiatives you want to be a part of. Another one of them that'll be upcoming is the governance aspect. So we have like about 8 different categories there. And I guess now we can get more into today's topic and subject matter. So yeah, I'm Jasmine, CEO of Rejuve.ai, of course, and my actual background before I got into crypto and AI and all this sort of stuff was actually in health information management. It was in hospital systems, analyzing medical records, actually. So kind of reading the doctor's handwriting, and John might actually have some experience on that medical coding side. So it'd be interpreting the medical records and the documentation specifically about what conditions people were diagnosed with, what type of procedures that they were undergoing, what kind of surgeries, and all this sort of thing, and translating it into ICD-10 codes to go next to the next stage of billing and insurance and that sort of thing. And I sort of got disenchanted with that work because I realized I was just reading basically people's death sentences and I couldn't do anything about it. So that kind of motivated me to get more involved. And I mean, I've always been passionate about longevity in the first place. And, you know, got involved in Singularity Net back at the inception. So it all just came together very beautifully here. So now I'll introduce Dr. John Thompson-Smith.
Thank you very much, Jasmine. And yes, I'm an orthopedic surgeon from the UK. With an interest in lower limb surgery, particularly knee surgery and sports injuries. And over the years, I've dealt with a lot of athletes at elite and amateur level, men, ladies, and children, with a wide variety of sports injuries. And that's really is where my interest and my background lies, really. And I've got a big interest in lifestyle, nutrition and longevity as well, and new technologies in the medtech space. And I also work with a company in the Netherlands looking at new health tech and medtech innovations. So I'm delighted to be involved as a medical advisor with Rejuve. And as an orthopedic surgeon, we're known as having a hammer and a chisel and a saw and not being very good at reading an ECG. But I will do my very level best to answer some of these questions. Obviously, I'm not a general practitioner, but I do have a good basic medical and surgical grounding. So I'll welcome some questions. Thank you very much, Jasmine.
Thank you. Yeah, and so we've thanks everyone in the community as well for submitting your questions. And I mean, how do you see, I guess before we get into those ones, like the field of how does longevity kind of intersect with what you're doing? Or do you see, is anybody, any of your peers like talking about it? Is it ever brought up? Like, is it a thing?
Yeah, it certainly is. I mean, obviously at the moment with the advent of artificial intelligence and the applications in healthcare, and a more well-informed population in terms of healthcare demands and healthcare needs. There's a great emphasis on longevity at the moment, and it's very much in the public eye. And we find that patients really want to live better for longer, so they want a healthier lifestyle, and they really want to live longer. And this goes along with a lot of the things that I'm seeing in the medtech space at the moment, in and around biotechnology, drug discovery, diagnostics in terms of early detection and prevention of disease, as well as delivering care pathways and patient management platforms in a remote setting. So it's very much a big topic, as we know, and something that I'm very passionate about.
That's great. Perfect fit and synergy here. And I guess, yeah, Melissa, I think everyone mostly knows who you are, but you can briefly state and then we can get into the question set.
It's okay. I was just sitting here being like, I'll just sit here as a physician on here. Um, that's my name is Melissa. Obviously, I am the head of marketing here at Rejuve. I host a lot of our podcasts and things like that with Jasmine. I come from a health and wellness and blockchain background. So while I am not a medical professional, I'm married to a dentist, so he has a doctor in front of his name. So basically, he's a doctor. Time on the side. But in any case, I'm super excited about this. I think that there's so much that we can learn, especially about chronic diseases. I'm excited. I think the questions that everyone asked for this are really relatable to a lot of things that are going on right now, particularly with our generation. So I'm excited to have Dr. John Thompson Smith answer all the questions.
Yep, and then yeah, as mentioned, the subject matter based on your questions, we're kind of converging upon chronic diseases, so that's our subject. So yeah, I guess we can go ahead to the first one.
Yeah, sure. Go ahead. So, Melissa, what was the first question that we had there?
I had to pull it up for a second. Okay, so first question. I feel like it may be a little bit of a background into chronic disease is, and just some general examples of what they are, how they can affect people. We'll dive into the specifics that people gave later in this, but
Yeah,
maybe just a general overview. And I feel like Jasmine had another question that tied in with that, but I didn't write
yeah,
down.
sure. So, I mean, we should really think of chronic diseases as long-term conditions. And when we talk about long-term or chronicity, it's difficult to assess timeframes. But in general terms, any medical diagnosis or any medical issue that's been going on for over 12 months is known as a chronic condition. These conditions often require medical intervention, and there often is no cure for some of these conditions, but they can be treated and modified to allow patients to have a good quality of life. Examples, if we use the NHS framework as an example, these can be divided into bodily functions, if you like. So the respiratory system, so common conditions such as asthma and chronic obstructive airways disease, musculoskeletal conditions such as osteoarthritis and rheumatoid arthritis, cardiovascular problems, the most common being blood pressure abnormalities, hypertension in the general population, which is extremely common. And then some endocrine manifestations as well, such as diabetes being a common one. And the other conditions not to forget about, and certainly ones that we can really focus on and manage in what we're going to be doing is obesity and mental health. And we see that over 30% of consultations in primary care in the UK are related to mental health disorders, as well as 30% in MSK, and that's something very much on our radar and something not to be forgotten about. So yeah, conditions over 12 months that have an impact on your quality of life and could be broadly divided or categorized into system types, if you like: respiratory, cardiovascular, musculoskeletal, etc.
Okay, my follow-up question with that, which I remember now, was, do you think, or is there any scientific data with that you can make chronic diseases go away with lifestyle changes and things like that? Or do you find that chronic diseases generally have to be treated long term, because like you said, they're over 12 months? What are your thoughts?
No, I mean, there is very well established evidence in the medical literature and new emerging evidence that certainly lifestyle factors play an enormous role in all of these conditions, actually, all the ones that I've just described. And in certain cases, there have been significant cases of diabetes mellitus, type 2 diabetes, which have actually been eradicated and treated purely by dietary and exercise regimes and interventions. Mental health, we know the benefits of health and well-being and lifestyle and exercise on mental health, and many of these conditions, including the cardiovascular and respiratory problems, can also be helped by the correct lifestyle decisions and coaching and advice in those areas. So yeah, there is very well established evidence. I think part of the problem is getting the message out there into the general public and education, and certainly that's definitely something we're going to be able to help with, along with the data and gathering data, personal data, biomarkers, heart rate monitoring, blood sugar levels. All of these things are going to play a huge part.
I'm excited to dive more into this with each of the chronic diseases that we kind of are highlighting on here, because I think that we talk about this on every podcast that we do. Basically, the end goal is people need to be more educated on what they can do, and the system needs to shift to more of a preventative type of data rather than reactive, in terms of like, oh, I have these symptoms, I need to fix it, kind of a thing. So all right, let's dive in to the first one. So Jasmine, you ready?
I'll just pick you up on that, Melissa. Yeah, I think you're right. Indeed, preventative medicine is at the forefront of our minds, isn't it, right now? And I think that's really the key, along with personalized healthcare, which is a tailored approach to each individual person, because we're not all the same, and people may need to be treated differently. But yeah, preventative medicine, personalized care, and also remote care, assisting people in the community via applications, phone applications, mobile applications, and that type of venture is really the way forward.
Yeah, I mean, it's super encouraging, to hear you kind of validate that, yes, indeed, sort of reverse such conditions. Yeah, especially if it was only 12 months, maybe that's a bit easier to do than something that's been going on for 10 years or something like that. And I'm full of, preventative medicine and personalized medicine, is that now such things are no longer in this kind of realm of like conspiracy and woo. Now we can actually utilize AI and big data and all this sort of thing to actually shed out methods to be able to actually reverse conditions and intervene. So yeah, very excited. So yeah, I guess our next one, I guess we can begin to focus more on, I guess more aligned with your field, specific chronic diseases related to arthritis. So can you tell us first, what is the difference between rheumatoid and osteoarthritis?
Yeah, sure. I mean, in terms of the incidence, or should I say prevalence, of those conditions, in the general population, osteoarthritis is approximately 10 times more common. than rheumatoid arthritis. And if you use the UK as an example, approximately 10 to 20% of patients will have a joint affected by osteoarthritis, which is obviously an enormous percentage of the population. These conditions are particularly debilitating. Osteoarthritis tends to affect a single joint, so one hip or one knee or one shoulder. And the causation is fairly multifactorial in terms of the understanding behind it. And it's thought that there may well be an inflammatory component to it, as well as generalized wear and tear. And also genetic and environmental factors play a huge part as well in terms of the load that that particular joint has been placed under over the years, hereditary factors and lifestyle factors as well. So rheumatoid arthritis, in contrast, is more of a systemic autoimmune problem, which is associated with what we call polyarthropathy or joint disease in multiple joints. Commonly, the small joints in the hand and feet are affected in the first instance. And it is very much a systemic problem, often associated with other conditions and other autoimmune problems. And in terms of the treatment modalities, again, these differ widely between the two. So osteoarthritis is very much a case of managing lifestyle factors in the first instance, reducing obesity to reduce the load on the joint, analgesic, so pain relieving medication, joint injection, physiotherapy, and then ultimately for debilitating pain, then surgery such as a hip or knee replacement. In rheumatoid arthritis, the treatment options have really advanced over the last 10 to 20 years, and there are some fantastic drugs available now to manage rheumatoid disease, including monoclonal antibody treatment, things that reduce things like inflammatory markers in the blood, like tumor necrosis factor, and even mild forms of chemotherapy as well. But the treatment of rheumatoid disease is very much in the advanced stages. So yeah, both conditions are debilitating, have a big impact on quality of life. Osteoarthritis is much more common, and we do see that a lot more. And rheumatoid arthritis is still a significant problem, but much more effectively managed these days from a medical perspective.
So would you say, I mean, typically we think of arthritis as affecting seniors or people that are a little bit older. Does osteoarthritis happen to the younger generation? I mean, I personally know a couple people with rheumatoid arthritis that are our age and younger, but talk to me about that.
Yes, indeed. No, we do see osteoarthritis in the younger population. And I mean, typically the patients are over the age of 60, 65. But we do see this in youngsters, 35, 40, 45 year olds. And really that's that can be a result of trauma. So it can be a post-traumatic case if somebody's injured a joint in the past, a hip or a knee, for instance. So post-traumatic cases. But I think here, this is where we really see genetic factors coming into play, because if you've got a slim, healthy individual with no history of trauma and significant osteoarthritis, then we must assume that there are some genetic components in and around the causation of that particular case. And again, it leads us on to things that will become very much in the public eye over the next 10 years, like genetic profiling and people's genomes and these types of pathways, and that's very important. Certainly when you see these younger patients with osteoarthritis, it really changes your decision making in terms of what can be done, because you certainly don't want to intervene surgically too young in that age group when you're talking about putting implants into the body. So patients should be educated and really advised to try and delay surgical intervention as much as possible, as much as it will allow. And then if surgery does come around, then you need to be very careful about joint preservation and potentially considering things like joint resurfacing or partial replacement of the joint. The knee would be a good example of that. And in the hip, it may be that you want to use a different type of bearing or implant choice if you do have those younger patients in front of you. So yes, Melissa, we do see it in the older population, but it is an issue with younger patients as well. And we need to bear in mind as well that the lifestyle choices of patients now are very different to what they may have been 10, 15 years ago. And patients want to keep going, as we said earlier. They're demanding, they want their lifestyle, they want to keep doing their sports well into their 60s and 70s now. So these decisions need to be really considered.
Gotcha. Well, that will be fun and exciting. But I wanted to ask some of the questions that we've gotten asked on our live right now. So the first one, before we continue on, what's the take on, is aging a disease? What are your thoughts?
I think that really depends on who you speak to. I think aging has generally been known as a natural process and a natural slowing down of physiology. I'm not sure at this stage we can say it's a disease per se. Normally in a disease state, there is a diagnostic procedure, be that a CT scan or an MRI scan or a blood test to pick up a pathology. And obviously, when we talk about aging, we don't have at this time such a diagnostic test to diagnose aging or to even quantify it. But there are emerging techniques and innovations which are going to be extremely interesting, including patients' biomarkers, which will help us provide, along with patient data, biological age. And I think this is really what we need to be thinking about now: people's biological age. So at this stage, I wouldn't necessarily call aging a disease process. I would call it a natural process. But the real question is, what can we do to influence that process in terms of longevity, and allowing people to live a healthy, normal lifestyle for many more years to come? And that's really the key question. But yes, it's an extremely interesting space, and I think with the use of biomarkers, genetic profiling, and all the data that we're going to be collecting, I think it's going to be a really interesting time.
Jasmine's back. I'm glad.
Hi, Jasmine.
Can you hear us?
Yeah, the inglorious parts of digital nomadism, hotel Wi-Fi. So hopefully I'll stay this time. I got the hotspot going, but we'll see.
Fingers crossed. Fingers crossed. I, as a non-medical professional, John, I think I would agree with you. There are a lot of people that think that aging is a disease, but I agree that I think that when it happens to the entire population, I'm not sure that you can call it a disease. Again, I'm not an expert.
Interesting. You're on the aging is a disease subject. This was a big one in our recent events. Like,
at this moment.
Yeah, we were just discussing there, Jasmine, with regards to aging and influencing aging, and we talked briefly about biomarkers and biological age, which is of great interest. But of course, we don't have a diagnostic test for aging at the moment, do we? So it's very difficult to quantify and to categorize it, really. So I think really it should be seen as a natural process, which may be modified by intervention.
Yeah, and I think too a good area to explore is actually the hallmarks of aging, which are featured in our app. I mean, since we've developed, there's even some new ones that we'll add on, eventually. But these specific things kind of more narrowly define those processes that we know as aging, like the shortening of the telomeres, the destability of the genome, and all these sorts of things. And I think if you slice it up that way, and like you sort of create interventions that target those slowing and kind of reversing and regenerating those pathways, then it's kind of more going in the direction toward, as they say, curing aging, rather than kind of seeing it as just this, one thing, because it can almost be defined the same way as like something rusting in the rain, right? It's just something that happens. Like,
Yeah, exactly.
Okay, there's another question in here. It's not entirely related to aging, but kind of. So we'll just answer it really quick. So basically, somebody wants to know, how do you go about choosing supplements to assist with chronic disease or longevity in general? Do you recommend taking tests first, like through our partners, or I think it's a little overwhelming to kind of assess in the beginning?
Yes, I think you're right. It is an overwhelming area, isn't it? And it's also slightly skewed by advertising and marketing for companies as well, in terms of selling products. And I think that that always needs to be borne in mind by patients. The first thing to say is that safety comes first. So I think that if there's any question about requiring a supplement, you should really seek some advice from your own general practitioner, from your family doctor in the first instance, or a registered dietitian. And I think, Melissa, you raised a good point about testing, because um, if you take vitamin D as an example, many of us Brits are vitamin D deficient. We don't get enough sunlight over here. Should all patients take a vitamin D supplement? Well, probably not, because if your vitamin D levels are normal, then excessive amounts of vitamin D could actually potentially be harmful in certain cases. So I think if there is a question mark regarding, for instance, a vitamin D deficiency, it's a very straightforward blood test. It's something that your general practitioner can organise. And of course, if you are found to be vitamin D deficient, then yeah, you can go on a supplement. I think that it really depends on what type of supplementation we're talking about as well, because many of these over-the-counter remedies that you can buy in the local supermarket may have a very good safety profile, but ultimately you really need to know what is going on at a biological level, and that's really going to involve blood testing and biomarkers. So in general terms, I think to start taking supplements, it would be recommended to have a chat with your own GP in the first instance, or your own dietitian, before embarking on that. But it's such a huge area. I mean, we could talk all day just about vitamin D, couldn't we? But yeah, certain supplements have certainly been shown to have antioxidant and anti-aging properties. For example, vitamin E, omega-3 are the common ones. Um, but the other thing to bear in mind as well is that nothing really supplements a supplement like a good diet. And many of these therapies we've just discussed are available through a good, balanced, wholesome diet. And that is really the first step to take, I would suggest, before going down the route of supplements. But hey ho, I take supplements. I take a vitamin D tablet every single day, but I was vitamin D deficient, and I also take an omega-3 tablet once a day as well, for an antioxidant effect. So yes, vitamin D has certainly been shown to have profound effects on the musculoskeletal system in terms of injury prevention and also athletic performance, as well as the other generic issues, such as your calcium metabolism and your general bone and teeth help, as your husband would be very happy to know about, Melissa, being a dentist. But yeah, in general terms, I think if there's any questions about supplements, then yeah, reach out to an expert, whether it's your GP or a dietitian, or somebody at the Rejuve team.
I would agree with that. I think this is my own personal experience, is that you can get on TikTok or you can get on Instagram and you can kind of self-diagnose a lot of things. People will be like, you got high cortisol? Do you feel like this? I've been susceptible to it myself, I'll be honest with you. And like, these are all the supplements you can take to lower that. Okay. I actually went and got a blood test and they were like, you dumb idiot. You actually don't have high cortisol. You're fine. It looks normal. But so they didn't actually say that. I'll just put that in there as a caveat. But it does go to say that, like, same thing of like, oh, your iron's low. Are you feeling sluggish and tired and things like that? That social media can give us a lot of opportunity to self-diagnose whatever we feel like. But in addition to that, while education is great, you really need a blood test. You really need to even do telehealth type of communication. You don't necessarily need to go face to face. There's so many options now in 2024, but I would say stay away from diagnosing yourself on social media because that tends to happen quite a bit.
Absolutely agree. And again, that comes back to my first point there, which is really safety. Safety first, and make sure that you're doing the right thing. And yeah, don't over Google. That is a very, very dangerous thing to do.
There was actually a session about that at the recent conference we went to, the Health Europe. They were talking about the dangers of, sort of, Dr. Google kind of thing, and how prevalent that's became. And I mean, it started a long time ago, but I guess now, especially with things like ChatGPT around, it's probably only getting increasing more. But as you mentioned, on the flip side, telemedicine is also a thing now too. Another topic that was covered is how a lot of times, people are kind of going into doctors and waiting in long lines and going through all these procedures when they really just needed a quick chat. And so now there's platforms kind of emerging to be able to facilitate that and do that a lot faster. So you save yourself some time, money, stress, all that kind of thing.
Absolutely. And I mean thank you, Jasmine. That really came to the forefront of clinical practice in the pandemic, because pre-pandemic we never did any telemedicine consultations. Everything was face to face, and then obviously we needed to reduce the footfall and the traffic through the hospitals, and all of a sudden we found ourselves doing virtual clinics, phone calls, telephone consultations, and to our great surprise, many of those patients absolutely loved it. And there were varying reasons. Sometimes the patients were happy they didn't have to pay for the hospital car parking, which was a real common reason. But yeah, you're right, Jasmine, the waiting times. And also, it's nice to have a chat with a doctor or a surgeon from the comfort of your own home. So I'm a great advocate of this. It's not appropriate for all cases, because in some cases you still need to perform a clinical examination and see the patient face to face, or you may have a particularly tricky MRI scan or CT scan to show the patient. You need the patient there in front of you to run through the diagnostic images. But yeah, I'm a huge advocate of remote healthcare in the community, and keeping patients at home, comfortable at home where we possibly can.
As a strong supporter of anything where I don't actually have to talk to people in real life, I feel like telehealth is literally my dream. I have utilized it since it became available in the pandemic, and I was like, perfect. I don't have to go in and talk to you. I can just do it over Zoom. Even better, or a phone call. I also feel like this is a side note, but I think it hopefully will continue to become more mainstream and alleviate a lot of pressure on the healthcare system by taking up so much valuable time that doctors and nurses and everybody have, because people overuse the ER and urgent care and stuff for things that aren't necessary, when you could just be like, hey, my
Yeah,
finger's cut. What do
yeah,
you think I should do
absolutely.
with it? Right.
And you're right. I mean, for healthcare providers, we saw a huge increase in efficiency and capacity within the hospitals by essentially being able to see twice the volume of patients in your clinic if if you're having a quick follow-up phone call. It's so much more efficient. So yeah, on both sides of the fence, I think patients have been delighted with it, and doctors as well.
Agreed. Okay, so there's another question which will kind of segue from this into the rest of our diseases. Of basically, so we have these chronic diseases, particularly diabetes and obesity. Sometimes go hand in hand together. Sometimes they don't, depending on the type of diabetes. But in any case, how can you lifestyle change essentially to manage either diabetes or obesity or both? Like what's the jumping off point?
Yeah, sure. I mean, again, it's a very complex area, isn't it? So the first thing is to get a prompt and accurate diagnosis from your general practitioner, your family doctor, or even your endocrinologist if you've been referred on. And that's the first stage, because you need to know what type of diabetes is. It's really a spectrum of disease, isn't it? From a very minor pathology, which can be controlled by dietary changes, through to non-insulin dependent or type 2 diabetes, where it can be managed with common drug therapies such as metformin or glycoside, right through to type 1 insulin dependent diabetes, which can sometimes be even congenital or juvenile. So it's really knowing the exact diagnosis and then speaking to experts in that field, whether or not it's a general practitioner with a special interest or an endocrinologist, because you could give generic advice to patients with diabetes about lifestyle choices, but it may not suit all of those patients. So it would need to be personalized for each of those patients in terms of assessing their body mass index, assessing their lifestyle, their dietary changes. But but in broad terms, I would break it down into three areas. One is diet, which is the obvious one. Everybody's talking about the Mediterranean diet in the UK at the moment. The Atkins diet seems to have gone out the window, and the Mediterranean diet is extremely popular because it's been shown to have certain anti-inflammatory effects, so it can help the musculoskeletal system, patients with rheumatoid osteoarthritis. But for diabetics, it could also potentially reverse some of those early changes. And I've certainly got friends who have been diagnosed with early stage diabetes. They've gone on a health kick. They've got themselves fit. They've lost weight. They've gone on the correct diet, and hey ho, they've got off their metformin. Their blood sugars, their blood glucose is now controlled. So they are certainly examples of how that can be managed. Um, Obesity, if we look at obesity as a whole, it's a significant problem worldwide. I know in the UK, depending on which statistics you look at, it's anywhere between 30 and 50% of patients are classified as obese, which is a body mass index over 30. And this is a confounding factor for many of these chronic diseases that we've already discussed today, particularly diabetes. And it's really paramount to get on top of obesity and try and prevent, delay, and treat diabetes and some of these conditions. And again, it's a vast topic, but it's something that is very much on the radar in terms of the National Health Service here in the UK and the sort of global healthcare service as a whole. And 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 certainly exercise plays an enormous role. It's a simple equation. If you are consuming more calories than you are burning off, then you are likely to put weight on. But again, it's tailored for each patient. Some patients are insulin resistant. Some patients have got genetic factors which predispose them to obesity issues. So it's really drilling down and knowing those individual cases and those individual patients. I've probably talked too much on that one.
No, that was actually really great. Yeah, it is kind of very multi-layered, and I mean, of course, it's become almost epidemic now due to kind of like the change in availability of food and the amount of engineering we can kind of do with that as far as making higher fat, higher calorie, more widely accessible, cheaper junk foods and all that kind of thing than ever before. So it's
Yes.
definitely something at the forefront. And then, as you mentioned too, there's kind of predispositions to putting on weight faster. There's hormonal differences between sexes and all that kind of thing. And yeah, that's part of what we're kind of constructing or going at with the Rejuve platform, is being able to crowdsource data from all over the world to be able to kind of drill down into that and then turn that into more personalized insights and recommendations that they can discuss with their healthcare providers to make a better, more actionable and achievable plan for them. I mean, because everybody knows the sort of basic things, but it's like, how do I go from knowing, oh yeah, exercise is good and fatty foods are bad, into an actual plan for my life to actually lose weight and maintain it. And since we're on the subject of obesity, this is like one of the major subjects that like everyone in the health space is talking about. GLP-1 inhibitors, this Ozempic drug. I mean, it's kind of like, it seems like a blockbuster drug. I mean, a lot of people are kind of touting it as like kind of the cure to this obesity thing. I mean, there's other on the other side saying, well, maybe we should not be drugging it away and actually doing it the old-fashioned way of dieting and exercising. And are people going to have to stay on this their whole lives? So, what is your take on this new thing?
Yeah, sure. Great point, Jasmine. I also like the point about the cost of some of the diets that are proposed, because with the cost of living crisis, it's certainly something to factor in. But I think personalized nutrition pathways are really the way forward in terms of these cases. Yes, there is really mass hysteria around these injections at the moment, isn't there? Particularly semaglutide, which is one of the most popular drugs. And to my amazement, a lot of these drugs were actually engineered in the 1970s, so they're not new. They've been around for around 50 years, but really increased in popularity from around 2017, 18, and really, I think in some circles, it's been seen as what I would call a quick fix to obesity. And I think that is a potential problem, because that really may indicate a lack of education for individuals, for um, people in the public, for patients, because I think before going down the route of this injection therapy, you really need to have exhausted all other potential sort of lifestyle change options before going down that route, in my opinion. And I would use orthopedics as an example, as osteoarthritis is a great example. I wouldn't rush straight in with a knee replacement on day one. I would talk to the patients about the body weight, about physiotherapy, about yoga, Pilates, exercise, all sorts of things before going down what I saw as the last resort, which was a joint replacement operation, or indeed any type of surgery. And I think that the other slight danger at the moment is that with people kind of jumping on the bandwagon with these injections, we don't really know the long-term outcomes and the long-term data over a 5 or 10 year period. And there is emerging evidence that in the long term, some of these injection therapies may actually do more harm than good. And in the short term, if patients are removed from the injections or take themselves off the injections, that can actually have deleterious effects on the health, and the weight can just immediately come back on. And again, this comes down to we talked a lot today about personalized care and individualized care, because drug resistance is important, and some patients may well be more resistant to these drugs than others. So you can't really say to your friend, I'm on this injection, I'll take it as well. It may have a completely different effect on your physiology. So I would err on the side of caution with these injections. And again, definitely seek advice from your general practitioner, from your family doctor, or your dietitian before embarking on this, because they're not without side effects either. They are associated with certain gastrointestinal problems, such as nausea and vomiting, abdominal bloating, and other areas of concern. So it's not shouldn't be seen as a wonder one-stop drug, and nor should it ever replace a healthy lifestyle and a good exercise profile, in my opinion. But I do think there is certainly a space for these injections, and I think the technology is fantastic. But there are studies also done to show that metformin, which is an extremely cheap drug for diabetes that is readily available, can increase the longevity of healthy individuals. So non-diabetics that take metformin may well have an increased lifespan in comparison to others. So it's yeah, it's not something to be taken lightly, but certainly an option for some cases.
Yeah, I mean, I agree. I think there's definitely a wide range of solutions. I mean, there's people who kind of need an immediate intervention, to save their life or to bring them off of a really bad path, and then there's other people who it's probably better for them to try some other approaches instead of going for that.
It's been really interesting for me to watch those that I know using Ozempic. I would find the ones that are having a lot of success with it are those that have some sort of other disease, particularly PCOS in women that's been tied to that, and have struggled to maintain like a healthy weight, things like that previously. So it's been really interesting to watch how effective like Ozempic and its counterparts have been for those in that particular category. And to be quite honest, I have like one of my best friends was on it. She lost a great amount of weight, hasn't been able to get pregnant for 10 years, had her and she's now pregnant with her Ozempic baby because somehow, I mean, like that's what they're calling it in the news. I don't know exactly how that happens other than I don't know. I guess this is why I'm not a doctor, but
I mean, in certain respects, just having your blood sugar plateaued, or should I say, just kept at a constant level,
stabilized.
is essentially stabilizing your systemic inflammatory system. So, at the end of the day, whether that's done by through lifestyle changes with diet and exercise, whether it's done with metformin or whether it's done with a semaglutide injection, if that blood sugar level is maintained at a certain level, there is huge evidence to show that that has a profound anti-inflammatory effect. So for your friend, it may be that um, the obstetric side of things, there may have been a certain inflammatory problem at a certain level. In the reproductive system, it's very difficult to know, but it's very interesting to hear that. And I think that's why for certain patients it's a valid option. I mean, hypothyroid and underactive thyroid gland would be another great example of that. It's very difficult to lose weight, and we do see patients with an underactive thyroid in a similar position, and this may have an application for those patients as well. But ultimately, I think a lot of these chronic conditions and the things we've talked about today are related to an inflammatory process, and I think that blood sugar is inherently related to that inflammatory process, and that's really what we need to dive down into.
Okay, so let's segue from that. I think inflammatory or inflammation is like a huge buzzword right now on social media of like, how do I lower the inflammation? So how do you lower inflammation in your body? So you mentioned blood sugar or maintaining blood sugar. Well, you and I guess we last week when we met in person talked a little bit about metformin. So maybe do you want to like explain a little bit of what that is if people don't know what it is and or other recommendations for maintaining stability in our bodies?
Yeah, sure. Yeah, metformin is as I just mentioned, is a very cheap first line drug for non-insulin dependent diabetes or type 2 diabetes to help balance and maintain blood sugar levels. It's one of the most commonly prescribed drugs worldwide. Um, and I'm not entirely sure how the research team got ethical approval for this, but they did a, a study looking at a cohort of diabetic patients on metformin versus patients, healthy individuals not on metformin, and then baseline health individuals. And basically, the upshot of the research was that even in healthy subjects that are not diabetic, metformin could play a role in longevity, i.e., a healthy patient who is not diabetic and then takes metformin may well have such a steady state in their baseline blood glucose level that that may have a longevity effect. But again, that is not me recommending everybody take metformin. I don't want you to go out there and start trying to buy metformin on the black market on the internet. That's not a good idea. It needs to be checked out with the GP. It's just emerging evidence. But ultimately, the most profound effect and the most effective way of lowering your systemic inflammation is dietary. And what we eat, what we consume every day, will have a huge influence on inflammation. And again, there is emerging evidence with regards to, you've probably all watched Game Changers on Netflix, and there's a lot of evidence with regards to certain inflammatory food products, certain types of red meat, beef, pork, etc., may well have an inflammatory effect on your systemic circulation as a whole, but at a more local level on your gastrointestinal system, or your gut health and microbiome. And this is another area that we're certainly very interested in at Rejuve, in terms of the gut microbiome, looking at biomarkers and the impact it has on systemic inflammation. And with that comes emerging evidence with regards to intermittent fasting as well, which has been well known for 10 to 20 years, whether it's the 5-2, whether it's the 16-8. I mean, I think you need a degree in mathematics to work out all the different potential equations with the intermittent fasting. But there is certainly a lot of evidence, particularly for males like myself between the ages of 40 and 50, that prolonged periods of fasting will have a beneficial effect, and maybe 12 or 16 hours of fasting to actually rest the gut and sort of facilitate a normal microbiome. So I hope that answers the question, Melissa. I would really focus on dietary changes, and with that comes exercise as well, which has a huge anti-inflammatory effect in terms of neurotransmitters, chemical neuromodulators, and yeah, it's a subject for another day. But
I know we're gonna have to like do a whole separate thing, I feel like, on gut health, because we do actually have a partner that works with us that you can get like a discount on taking a like gut biome test to see exactly what's happening in there. But that's a thing for another day, I guess. I That's a topic that I feel very interesting. As we always talk about, like, abs are made in the kitchen. Like 80% of lifestyle changes happen with the food that you eat, and then the other 20% is exercise. And I know that as an avid exerciser, that man, if my diet was like 100% clean, but unfortunately, it's not 100% clean. But all right, we only have a couple minutes left. Jasmine, do you have any other questions that you wanted to ask about this before we I guess hang up and be finished?
I was gonna say, do we have anything more from in the chat on the live stream, or
Not at the moment. No.
have we kind of addressed everything?
We
Okay.
So, all right. Well,
I think there was a delay, but yeah, just wanted to again highlight that we're currently kind of mobilizing all of the clinical professionals in our community, in the Rejuve community. So please reach out to us if you would like to get more involved, and we'll probably make this a bit more of a regular series, as kind of Melissa hinted on. Maybe we'll have some sessions on other specific topics like gut health. Probably next will be mental health, as our other advisor is a
we may have just lost Jasmine there.
I was just trying to wait and see if it was just me, but I think it might be her. Anyways, I guess we'll see if she comes back. But as she was saying, our next one ideally I think will be on mental health. So you have any questions, a new form out asking for topics for that. Again, as always, we're not diagnosing you, telling you to do specific things, but more just having conversation about what's popular, what's happening. So please don't do your TikTok research and AMA research. Like, go talk to your actual professionals about thanks for everyone for tuning in, and we will see you next time on our next medical roundtable.
Thank you, Melissa. It's been a pleasure to answer some of those questions this evening. Have a great day.
Thank you.